Assalamu alaikum. Today we are bringing you a new tutorial on the anatomy of the humerus as a bone from the upper limb, and as usual we are going to discuss important features of the humerus from different aspects and also the attachments of the muscles on the anterior and the posterior aspects of the humerus. The humerus is the bone of the arm and it is the longest bone of the upper limb. It has an upper end, a shaft and a lower end. So as usual, the three parts of the long bone of a typical long bone is seen in case of the humerus, and so humerus is also a typical long bone. And now talking about the side determination of the humerus, the upper end is rounded. The upper end is rounded to form the head, and it is directed medially upwards. It is directed medially upwards for making the joint of the shoulder. The greater tubercle here is on the lateral side of the bicipital groove or the intertubercular sulcus. So this depression is called the bicipital groove or the intertubercular sulcus, because this is the sulcus, this is the depression between the two tubercles, the greater one and the lesser one. The downward prolongation of the greater tubercle is called the lateral lip, and it is an elevated line, and the downward prolongation of the lesser tubercle is also an elevated line, a shorter one, and this is also called a medial lip. And the line separating the head from the rest of the upper end, this upper end, and this line that separates the head from the upper end, the remaining parts of the upper end, it is called the anatomical neck. And the line separating the upper end of the humerus from the shaft is called the morphological neck. And this morphological neck lies 0.5 centimeter above the surgical neck. So we have the surgical neck here, and only 0.5 centimeter above the surgical neck is the morphological neck. So we see here where is the surgical neck actually located on the posterior side, posterior view. And it has three borders. The humerus has three borders, three surfaces in the shaft. So the three borders we are seeing here. We see here anterior border. This is the first border, anterior border, the medial border, and the lateral border here on the posterior aspect. So these three borders. And the three surfaces, we see here the anterolateral surface and the anteromedial surface, as well as the posterior surface. So now in the middle of the anterior border, is the anterior margin of the deltoid tuberosity here. So the anterior border, this is the deltoid tuberosity. In the middle of the lateral border is the radial or the spiral groove. This is the radial or spiral groove, and this is found on the lateral border in the middle part. And near the medial border, in the anteromedial surface, this point is the nutrient foramen. the nutrient artery enters into this channel and supplies the interior of the humerus. And the capitulum, the little head, the capitulum is rounded, projection on the lateral side which articulates with the radius. So this capitulum is articulating with the radius, and the trochlea, this one, the trochlea is medial to the capitulum, as you can see here, and it articulates with the trochlear notch of the ulna. And this is an important articulation, and this is an important joint of the upper limb. So the trochlea articulates with the trochlear notch of the ulna. It's very easy to remember that. And the trochlea articulates with the trochlear notch of the ulna. And the capitulum, it is rounded projection, and it is on the lateral side, and it articulates with the radius. The trochlea has two edges here, the medial one and the lateral one. The medial one is larger, and the medial edge projects downwards, which is 6 millimeter more than the lateral edge. This projection, it is 6 millimeter more lower than the lateral edge, and it results in the formation of the carrying angle. Carrying angle means your hand, when you stretch your arm and the forearm, when you extend it, when you are in extension, your arm and your forearm will not be in the same straight line. They make an angle. The coronoid fossa accommodates, this coronoid fossa accommodates the coronoid process of ulna in flexion. So when you do flexion, it accommodates the coronoid process of ulna to move towards these fossa. And the radial fossa here in this lateral side, the radial fossa accommodates the head of radius. The head of radius when the elbow is flexed. When your elbow is in flexion, this radial fossa accommodates the head of radius. And the olecranon fossa on the posterior aspect of the humerus, this olecranon fossa accommodates the olecranon process of ulna when the elbow is extended. So basically the posterior part is important for extension when we talk about the joints of the bones of the upper limb. And this olecranon fossa is accommodating, it's providing the area of the insertion of the olecranon process of ulna when the elbow is extended. The medial epicondyle, the lateral epicondyle, and the olecranon process. We don't see the olecranon process here because the olecranon process is of the ulna. So we are talking about ulna later on. So the olecranon process of ulna, which is going to be inserted on this area, the olecranon process. This is the olecranon fossa for the insertion of the olecranon process of the ulna. So these three bony projections, they form an equilateral triangle in flexed elbow. When you flex your elbow, these bony projections 1, 2 and 3 will be the olecranon process of ulna. So these three bony projections form an equilateral triangle in flexion of the elbow, but all of these three bony projections are in the same line. They are in the same straight line when the elbow is extended. Means when your elbow is in extension, then these three bony projections will lie. Talking about the insertion of the muscles, I am now highlighting the most important parts here first of all. So this is the common flexor origin when we talk about the flexor muscles of the forearm or antebrachium, the forearm muscles. Most of the flexor muscles are originated from this area, which is the medial epicondyle of the humerus. So from this medial epicondyle, majority of the flexor muscles are originated. So this is the origin of the flexor muscles that we can say. And the common extensor origin, this area, same as the medial epicondyle, in the lateral epicondyle we have the common extensor origin, means the majority of the extensor muscles of the forearm are originated from this lateral epicondyle. It is very easy to remember the origin of the flexor muscles and the extensor muscles. We will discuss about it on the upcoming lesson on the forearm. Now, here are two important muscles on the lateral epicondylar ridge. So this first one, this is the brachioradialis muscle, from brachium from the arm to the radius muscle, from radius to this area. So this is the origin of the brachioradialis muscle, and this is the area of origin of the extensor carpi radialis longus, the lateral epicondylar ridge. And we have a very huge area of brachialis muscle, as you can see here, up to this, I should say up to this area. This is the area of the brachialis muscle. So basically the brachialis muscles occupies the most of the areas of the lower half of the shaft. So it occupies the lower half of the anterior aspect of the shaft. And we have the deltoid muscle here, like a U-shaped deltoid muscle insertion, and the nutrient foramen, and we have the coracobrachialis muscle here. So we can see coracobrachialis means from the brachium, means from the arm up to the coracoid process of the scapula. So this is insertion, not an origin. And the medial head of the triceps brachii can be projected here. So this area is the medial head of the triceps brachii. And we have two important muscles here, the latissimus dorsi. On the bicipital group, we have the latissimus dorsi under the bicipital group, and on the medial lip, we have the teres major muscle. Teres major is on the medial lip, and we have the teres major muscle on the pectoralis major, I'm sorry, not teres major, the pectoralis major muscle on the lateral lip. So here is the pectoralis major, and this is the teres major. So you can remember these three muscles using the mnemonics: ledi between two major. Ledi means the latissimus dorsi, two major means one is the teres major and one is the pectoralis major. The lateral one is the pectoralis major and the medial one is the teres major. So this is teres, this is latissimus, this is pectoralis major, and this is the latissimus dorsi muscle. And these are all about the incision to the muscles. You know that these two tubercles are important areas of incision of the two muscles. This is the supraspinatus muscle and here is the subscapularis muscle. So you know that this is the incision of the subscapularis and this is the incision of the supraspinatus. So apart from that, there is no any other muscles remaining that we don't discuss here. So we have completed the important incisions of the muscles on this anterior aspect. So coming towards the posterior aspect, there are only 5-6 muscles, as we can remember, because the other muscles are repeating here, as brachialis muscle, here the brachialis muscle, we can see parts of the brachialis muscle. And the deltoid muscle, on the deltoid tuberosity, we can also see here on the posterior side as well. And the lateral head of triceps brachii that we didn't see on the anterior surface can be seen here. So now here you can see the lateral head of the triceps brachii here. So this is the lateral head of the triceps brachii. And we have the radial groove, and here is a big muscle, a huge area is occupied, as in the case of the anterior aspect. The brachialis occupied a huge area of the shaft on the anterior surface. Here is the triceps brachii, the medial head of the triceps brachii, the medial head of the triceps brachii. So medial head of triceps brachii occupies the lower half of the shaft on the posterior aspect of the humerus. And we have a small muscle but very important muscle here, the anconeus muscle on the lateral epicondyle of the humerus. On the posterior aspect, it is not seen on the anterior aspect, so it is important muscle, anconeus muscle. And we have 3 muscles here, starting from the top of the surgical neck here, the top of the head here, the supraspinatus muscle, on the lateral tubercle, the greater tubercle, and as we have seen on anterior aspect, it can also be seen a small part of the incision here. But the important muscles of the posterior, especially for the posterior surface, is the infraspinatus here. So this area, which is occupied by the infraspinatus muscle, coming from the inferior infraspinatus fossa of the scapula, the muscle is inserted here. And we have the teres minor muscle here. We didn't see teres minor muscle on the anterior aspect. Here, the teres minor muscle is inserted. So this is the area of attachment, area of incision of the teres minor muscle. So friends, that is all about the important points of the humerus, and we have also discussed the major attachments of the muscles on both the anterior and the posterior aspects of the humerus. Lastly, one point that should be kept in mind is that humerus is not only clinically important because of its presence of the arteries, the humeral artery and the nerves, but also important, it is also clinically very important because of the presence of its two ends which articulate with major bones of the upper limb. As the lower end articulates with two bones, the ulna and the radius, and the upper end articulates with the scapula. So these ends, the articulating ends, are clinically very important, and the remaining parts related to the radial nerve, the arteries, we are coming forward and we are discussing it one after another. Keep watching and that is all about the important points of the humerus, and we have also discussed the major attachments of the muscles on both the anterior and posterior aspects of the humerus. So lastly, I would like to highlight an important point that should be kept in mind, that the humerus is not only clinically important because of the presence of some vital vessels and nerves, but it is also clinically very important because of the presence of its two ends, the lower end which articulates with two bones, the radius and the ulna, and the upper end which articulates with the scapula. So the construction of the upper limb is regulated by the functioning of these two ends, that is the two important joints of the upper limb.